everyone, I am attending surgeon of the First Hospital of China Medical University. Today, we are going to talk about some problems affected almost everyone. Well, most of them avoid to seek medical attention until it is too severe. More or less, everyone was, is, or will be suffered from one of these diseases sometimes or even their whole lives. Maybe they are not as serious as some diseases like heart attack, stroke, or cancer. But a toilet like this won't be a great lifetime companion, right? So, what are they? Today, let's get a general idea about some common anorectal diseases: anal fissure, hemorrhoids, rectal prolapse, perianal abscess, and anal fistula. The last two actually are the same one, anorectal separation. An anal fissure is a linear ulcer usually found in the midline distal to the dedicated line. It is very common in young infants, but can affect people of any age. Pain, blood, and constipation are three typical clinical manifestations. Fissures can be classified as acute versus chronic and typical versus atypical. Acute fissures cause bright red bleeding with bowel movements and sharp burning tearing anal pain and spasm that can last for hours after the bowel movements. An acute anal fissure appears as a fresh laceration, while a chronic anal fissure has raised edges, exposing the internal anal sphincter muscle fibers underneath. Chronic anal fissures are also often accompanied by an external skin tag at the distal end of the fissure and a hypertrophied anal papilla at the proximal end. Atypical fissures can occur anywhere in anal, can have a wide variety of findings, and can tend to be associated with other diseases, including malignancy, Crohn's disease, HIV infection, syphilis, and tuberculosis. Biopsy should be done if the tissue is typical or no healing to exclude other diagnoses. Typical fissures are usually located in the posterior or anterior midline, have the characteristic findings. Given that a hypertonic sphincter and large hard stools may contribute to anal fissures, most medical therapies are directed to achieve the goals of relaxation of the anal sphincter without causing fecal incontinence, passage of soft and formed stools, and relief of pain. Many pharmacologic agents have been considered, including topical nitric oxide, calcium channel blockers, and botulinum toxin injections. Non-surgical therapy is safe and often effective with limited side effects and should be the first-line therapy for anal fissure. However, a subset of patients may benefit from a prolonged surgical intervention, and the treatment should generally be individualized. Lateral internal sphincterectomy remains the operation of choice and has been shown to be superior to all other medical therapies, anal dilation or fistrectomy. In patients with chronic or recurrent fissure with hypertensive anal sphincter, fissurectomy with endoanal advanced flap is the alternative surgical approach. Hemorrhoids are cushions of submucosal tissue in the anal canal containing small arteries, veins, and smooth muscles. They are part of the normal structure of the anal canal and an important component of the continence mechanism that aids in complete closure of anus at rest and allow passage of stools as and when required. Because hemorrhoids are a normal part of anorectal anatomy, treatment is only indicated if they become symptomatic. Signs and symptoms of hemorrhoids usually depend on the type of hemorrhoid. External hemorrhoids are under the skin around anus. Signs and symptoms might include itching, irritation in anal region, pain or discomfort, swelling around anus, bleeding. Internal hemorrhoids lie inside the rectum. Patients usually can't see or feel them, and they rarely cause discomfort. But staining or irritation when passing stool can cause painless bleeding during bowel movements. Small amounts of bright red blood on toilet tissue or in the toilet. A hemorrhoid to push through the anal opening, resulting in pain and irritation. If blood pools in an external thrombus and forms a clot, it can result in severe pain. Hemorrhoids can develop from increased pressure in the lower rectum due to straining during bowel movements, sitting for long periods of time on the toilet, having chronic diarrhea or constipation, being obese, being pregnant, having anal intercourse, eating a low-fiber diet, regular heavy lifting. So, the best way to prevent hemorrhoids is to eat high-fiber foods, drink plenty of fluids, consider fiber supplements, don't strain, go as soon as you feel the urge, avoid long periods of sitting. Internal hemorrhoids can be divided into 4 grades. Grade 1, slightly enlarged hemorrhoids that can't be seen from outside the anus. Grade 2, larger hemorrhoids that sometimes came out of the anus. For example, while passing stool or less commonly during other physical activities, they then go back inside again on their own. Grade 3, hemorrhoids that come out of the anus when you go to the toilet or do other physical activities, but don't go back inside on their own. They can be pushed back inside so. Grade 4, hemorrhoids that are always outside the anus and can no longer be pushed back inside. Usually, a small bit of the anal lining comes out of the anus too. This is also known as rectal prolapse. Patients can often relieve the mild pain, swelling, and inflammation of hemorrhoids with home treatments. Eat high-fiber foods, soak regularly in a warm bath or safe bath, over-the-counter creams, ointments. These products contain integrins such as vasohazel or hydrocortisone or lidocaine, which can temporarily relieve pain and itching. It is a painful blood clot has formed within an external hemorrhoid. Removal of the hemorrhoid, which can provide prompt relief. This procedure, done under local anesthesia, is most effective if done with 72 hours of developing a clot. Minimally invasive procedures for persistent bleeding or painful hemorrhoids, like rubber band ligation, injection, coagulation. Only a small percentage of people with hemorrhoids requires surgery. However, if other procedures haven't been successful or large hemorrhoid, some of the following will be recommended. Hemorrhoidectomy, hemorrhoid stapling. Today, we just talked about the common anorectal disease. Actually, still lots of uncommon ones. If any questions, I will always be there for you. The First Hospital of China Medical University. Thank you for your attention.